dwindled. The lockdown has seen a surge in gender-based violence, and these facilities are inundated, but they don't have money to stay afloat.
Many walk through these doors bruised and battered, trapped at home with abusive partners during the lockdown. Over 20 women and children are accommodated here, escaping a consistent pattern of abuse. The lockdown has seen a spike in gender-based violence. Shelters like these, the anchor for now.
A place of safety for women is absolutely essential. It is considered an essential services under lockdown. And it's important because you're going to be saving lives. Given that South Africa has, terrible statistics on violence against women and femicide, it's very important that we become cognizant of this with absolute immediacy.
Harriet Glover started out as a volunteer. She's now a house mother providing counsel to dozens who arrive here in a desperate state. It's an invaluable service, a lifeline, and she too is worried about the survival of centers like this one.
I understand domestic violence clearly, and I know how it is like to be in an abusive relationship. So I love my clients and I like working with women that are being abused so that I can help them.
With the exception of Gauteng, who have made plans, it seems like in the other provinces that hasn't happened. So organizations have no funding agreements and contracts in place with DSD. They don't know how much funding they're getting and they don't know when they're going to get it. So they're living off their reserves. We do not need social care services in this country to collapse. We've just had them declared essential services. So the point is, what thinking is going into how they are going to find additional money to fund those services, how we're going to get funding to them now with DSD itself in lockdown and with them not having access to their contracts.
Several centers have been opened for GBV victims during the lockdown, but those not sponsored by government can barely keep their heads above water. Donations can be dropped off at the Johannesburg Food Bank in Boysens. Gillian Pillay, SABC News, Johannesburg.
Well, as the COVID-19 pandemic grips the world, the severe lockdown has seen an increase in gender-based violence in some parts of the country. Gender-based violence is an issue that many women contend with under lockdown. In some cases, some women are subjected to psychological abuse, and for others, it's financial abuse. We now speak to Dr. Shaheda Omar, the director of the Teddy Bear Clinic, to share more insights to the discussion. Dr. Omar, thank you so very much for joining us here on SA Today on SABC News.
Good afternoon to you. And
Dr. Omar, we're seeing an increase of gender-based violence during this lockdown. And of course, we know that there's 2 weeks that have been added to the lockdown. Talk to us about some of those cases that perhaps you have or are encountering during this time.
So over the past 2 weeks, what we've experienced is that there has been reporting, and we also explored further than just the referrals that came directly to the Teddy Bear Foundation. We've received reports and referrals of domestic violence where there's been attempted murder, attempted suicide because of the financial abuse, the psychological abuse suffered by females in the household. We've also had children witnessing this domestic violence and being subjected to abuse themselves and being very traumatized by this experience. However, as I said, we've explored further and we went to a medical legal clinic in Soweto and just followed up on the trend that was rising. And of the cases that were there, 16 of them were child sexual abuse and the other 16 were that of domestic violence. So we need to realize that this is underreported, under-frequently reported, and as you've so beautifully articulated, because of the lockdown, people are trapped. They do not have access to online support, to social media, to cell phones. In the domestic violence situation, often all resources or access has been deprived, and therefore they continue to be violated and subjected to further trauma.
what would you say then to, you have situations where perhaps one would know of a neighbor, let's just say, who is being abused. What's the first point of contact? Who do you talk to? What do you do? And really, are they capable at this point, when we know that the police, together with the SANDF, are far too busy trying to stop people from having social gatherings, that perhaps those people that are facing abuse are not really being paid attention to at the moment? What does one do if you do know a case of someone who is in that situation at that time, if they don't have, as you say, they can't call, they can't go onto social media, all those things? What must one do?
So that is a great way to move in terms of the rallying for community support, for neighborhood support, reaching out to a friend, to a neighbor, somebody that is within close proximity, in whom you can trust and access some kind of intervention, whether it's law enforcement or social development or the command center for gender-based violence. I think that buddy system, or the Ubuntu system of making it everybody's business, whether it's child abuse, domestic violence, people should all rally around and ensuring the protection and safety of women and children, who are the most vulnerable and marginalized population group, and under these circumstances of lockdown actually have no recourse, no way to get support. So reaching out and ensuring, I think that is something that the government and civil society should have planned and deliberated on actively before going into lockdown. For children also to have buddy systems, for adults to have that kind of support where they know that should anything happen to them, should they be in a crisis state, they could reach out without actually leaving the confines of their home or being subjected to further brutalization or violation.
Now, alcohol has been linked to further abuse and violence. And earlier on the show, I was having a conversation with the Beer Association of South Africa, and they've basically written to government, to the president, asking that the rules around the sale of alcohol be relaxed. I would like to know what your view on that is, because they are very firm on the fact that we can't really put the two together.
So if we look historically and just in terms of the trends of domestic violence and femicide, alcohol does exacerbate the problem. And a lot of the times the perpetrators or the criminals have attributed their violence and violent reactions to alcohol. So relaxing this, especially during lockdown, when people are frustrated, feeling helpless, powerless, boredom, the isolation, feeling abandoned, the anxieties, the panics and fears would certainly not be eased by the use of alcohol. In fact, it could contribute to further violence, and of course, who would the violence be targeted at? It would be targeted at people that are closest to them, and usually it's children and women.
What are you expecting to see, after the lockdown, and perhaps after we've gone through this period where we're dealing with the coronavirus? Because, as you rightly say, not many of the cases have actually been even reported. Are you expecting scary statistics after this?
Absolutely. We are expecting the reporting. The incidence, of course, is occurring now, but post-lockdown, we see an increase in the statistics, but in the trauma, and I think we're going to see a lot of post-lockdown mental disorders and psychosocial ills of the post-lockdown period. We're already preempting the depression, the anger, the frustrations, and the post-traumatic stress disorder, because after lockdown, it doesn't mean that all the woes have disappeared and life just goes back to like it was before. There are going to be many other challenges. And in terms of living conditions and employment, and children's education, which has been disrupted. Of course, DB is looking at a recovery program, but we know that it's a very tall order. So generally, and I think systemically, there has to be a very concerted drive on every government department, every civil society organization to look into this period post-lockdown of reaching out to society and enabling them to move on, whether it's financially, emotionally, psychological support. But there's going to be a lot of support that would be needed on multi-levels.
And where is this support available? I mean, for those who are able to perhaps get that kind of support now, where can the Diribe Foundation be contacted, or other bodies that perhaps can help in these times? Where can these people go? Because we did mention in the beginning that a lot of these people are feeling very trapped in these abusive homes. But ideally, perhaps one should be moving them away from those abusive homes, where some of them could even face death at the end of the day. So where exactly are these people supposed to go, and who must they contact to get away from these abusive environments?
So ideally, I would say, why should a woman leave the home? Why should a child be removed from the home? The perpetrator needs to be removed. The perpetrator needs to be booked and held accountable for his or her actions. However, in response to your question, there are the 24-hour helplines like the Command Center for GBV, which is under the auspices of the Department of Social Development, and their number is 0800 428 428. It's a 24-hour facility for any domestic violence issue, GBV and F issues. And your child lines, which is a toll-free number, also 2411. Then there's SADC, which addresses the issues around depression, anxiety, and mental disorders, which can also be a useful resource. And there's the Lifeline. So I think these are the platforms where people can access support if they have access to online mediums or modes of contact. So, I mean, that would apply only to those, not the majority, but those that have access.
All right, Dr. Shaheda Omar, always a pleasure, and we thank you very much for giving us all that information and giving us your time. We will, of course, continue to give you those numbers that you can call, but just on the back of that, that 24-hour line for domestic abuse is 0800 428 428. Of course, as SABC News, we have been giving you those numbers through some of our bulletins, and we'll continue to do so. Please do reach out and get that help that you need if you do find yourself to be in some sort of an abusive environment. All right.